Okay, it's Dr. Buford. We're just getting started on the right knee first. We're looking in this medial compartment, and you can see the area where the meniscus is not in great shape here. We're going to take a basket, or basically a pair of scissors, just to help us. I'm sorry. Yeah, that's great. Just to help us trim out the part of the meniscus that is torn here. We'll show you what that looks like. It's basically just a fancy pair of scissors. That's it right here. And so we'll just get to work on this, and we'll show you some more in just a minute. Okay, so you can see how we've trimmed back this meniscus back to a stable rim. Try to leave as much as possible. Just drop it down. We're going to look in the central part of the knee. This is where the anterior cruciate ligament is. That actually looks pretty. In just a minute, we'll look in the push up against the table. We'll look in the lateral compartment here. No, off the table, but bend the knee to 90. Yeah, perfect. And so here's the lateral meniscus. There's a little bit of wear and tear here as well. So we'll trim this back just a little bit, and then we'll show you the patellofemoral compartment next. Okay, so now we're looking at a part of the knee called the trochlea. This is where the patella glides down through here. There's really not much arthritis in the trochlea. That's a good sign. We'll look up at the patella. There's a little bit on the undersurface of the patella here, but not too bad. So I think we're done. We're going to take one more look around the entire knee just to make sure there's nothing else, but otherwise this will be the end of the right knee surgery. Is it recording? Yeah. Okay, so this is now the left knee. And you can see the degenerative meniscus back here as well. You can see another meniscal flap here. Okay, so we'll show you some more in just a little bit. Push it down on the pump. $50's fine. Okay. Recording. Can you take a Raytech, please, and put it around the shaver? Thank you. We're just finishing up on the medial compartment on this left knee. Things are looking pretty good. Pretty good look there. And now as we look, here's the ACL in the left knee. That looks pretty good. And now we're going to look in the lateral compartment in just a minute. Okay. This lateral side's looking pretty good. I think we're pretty much done over here. We had to trim a little bit in this region, but the bulk of this meniscus on the lateral side looks pretty good. So next we'll look at the patellofemoral joint. Okay, so this is the patella at the top of the screen, and as we would expect, there's some arthritis on the undersurface here too. Nothing super loose. And then here's the trochlea in the middle of the knee, and we can track this all the way down the front. And so you can see some thinning right in this region here, but otherwise nothing super loose. And so we're going to keep working here. We'll have one more look around the rest of the knee, but I think this will be the end of the video. I don't think there's anything else significant surgery-wise that we'll have to do. So good luck to you now. Bye-bye.